Hey Miss LeBon, this is Renee Lowe, and this is my $4.99 presentation. For my $4.99 internship, I did all of my 240 hours at Lafayette General's Wellness Center, and their mission is promoting good health through education, attention to lifestyle, and specialized physical activity. Our goals at Lafayette General were to get as many people who are part of the school board to participate in our health screenings, and show these patients how to better themselves or how to remain a healthy lifestyle. Also, we wanted to get as many of our Lafayette General employees to compete in our wellness challenge we were having. The wellness challenge was 6 months long and consisted of 50 Lafayette General Medical Center employees who competed to better themselves physically and mentally. The employees were required to exercise at least 3 days a week for at least 45 minutes, attend at least one personal training session every week, and keep a food journal. Every month the contestants would come in and complete an evaluation to see if their numbers were improving or not. If they failed to work out or schedule an evaluation, they received a warning. If they failed again, they were to pay a full year's membership. This challenge showed improvements for everyone and was a huge success. The winners received 3 years membership, 4 personal training sessions, 1 nutrition counseling session, and a $150 Visa's gift card. The Lafayette Parish School System provided all their employees with our free health screening and a free Be Well t-shirt. The employees do not need insurance. All they need is to be an employee of the school. They also get a few dollars off per month if they would like to become a member at our wellness center. The information from these results remains totally confidential, and the school board will not see any of these results. I had many responsibilities at Lafayette General, all of which included providing a basic lipid profile test, which tested their cholesterols, HDL levels, LDL levels, triglycerides, glucose, and risk ratio for heart disease. And also, one of my responsibilities was to go through these results with the patients. Take a recording of the patient's blood pressure, get the patient's body fat percentage and BMI, and also measure the patient's hip to weight ratio. What I learned during my internship was how to do a lipid profile test, body fat analysis, and blood pressure, how to run personal training classes, and how a wellness center actually works, and also what it takes to get the employees of the school board to sign up and participate in health screenings. Some of the successes we had was the amount of people we actually had participate in the health screenings. Everything I learned and the relationships I built with the people who worked around me, and also reading patients' results who were good and to see the happy look on their faces. Some of the challenges I faced was actually getting some of the people to participate in our health screenings, and also learning what to tell people when they ask how to improve their results. Another challenging part was how to tell someone the bad news of if their blood results were not good. Everything I have learned during this internship will help me out in my future career because I plan on doing something similar to what I did. This experience made me really learn how to talk to people that I had just met. All of my challenges I overcame and learned how to overcome them. They made me realize that people just want you to give it to them straight. Do not use words like maybe or kind of. Tell them you need to do this, or I really recommend you do this. They listen, trust me. Where will I go? After graduation, I plan to go back home to New Orleans and try to find a job. I am currently looking for jobs at local hospitals and gyms around the New Orleans area. I am not sure whether or not I want to go into health screenings or personal training. I would rather go into just doing both. Classes that helped me out were Kines 110, 111, 303, 304, and Diet 200. These classes all taught me about exercise and nutrition, which helped me out a lot when patients ask me for advice to better themselves. The class that helped me out the most was Dr. Bellar's 303 and 304 classes. This class was very difficult, but it pushed me to learn so much about how the human body works. It also taught me how to take someone's blood pressure and take his or her body fat analysis. We need a class at ULL that teaches us how to do a basic finger prick and practice how to go over these basic results. I really did just have no idea what to tell people at first when they asked what these results meant. I understood the definitions but was thrown into the fire when first asked to go over the results. My overall experience at Lafayette General was great. I learned a ton and had some great experiences that will help me out in my future. I enjoyed this internship so much and got to meet some great people along the way. I would recommend interning at Lafayette General's Wellness Center to anyone who asks me.